Whew. Well, summer in Kansai, rainy season, humid, unpleasant. So this was going to be a much longer video, but I'm going to keep it short. Today we're going to talk about healthcare. Yay! Single payer even, in Japan. With the big brouhaha going on in the States about healthcare, I figured it would be a good time now to talk about healthcare in Japan and how kind of single payer works here. In general, you're going to be enrolled in the national health insurance. Now, as a university employee, I get my health insurance not directly from the government, but through a group that is kind of like a value-added group. It's not a union, it's just a conglomeration of private universities, and so I get my insurance through them, and then they get that insurance basically is passed on through to the national health insurance, and it functions exactly the same way. When you come to Japan, your employer is going to, ought to sponsor your health insurance. So what that means is you pay half and the employer pays half. And probably if you're getting the visa, that's who's going to be paying for it. Now, if you are a independent contractor, probably nobody's going to be paying for half of your health insurance, and it will get a little pricey, I imagine. Health insurance costs are based on what you made last year. So if you go from a year where you're making a lot of money to a year that you're not making very much money, that year's going to be really unpleasant. But from there, it's going to the year after it's going to be much cheaper. If you are from the U.S. or Canada, and I'm not sure about other countries as well, because you're coming in that first year and don't have a salary history previously, that first year is going to be really, really cheap, and then it will go up each year after that. Basically, it's 25% of your salary, and your employer pays half, and you pay half. So it ends up being about 11%. Basically straight off the top of your paycheck every month, and if you get bonus checks, it comes out of that as well. And there's a little bit of a difference between the bonus month and the regular months, but it's not a big enough difference to really matter. Just figure it at about between 10 and 12%, and you'll get and that'll be a pretty good rough estimate for how much it's going to cost you. Okay, so that's how you pay for it. Now, so in general, the way it works is your health insurance pays 70% of whatever it is that you're getting done. It covers dental, it covers eye, vision, and it covers basically any hospital or physician visits that you want. If the procedure or thing is considered optional, it's a voluntary choice or cosmetic, then you got to pay for the whole thing. And for the most part, healthcare in Japan is nonprofit. So even the companies that are doing this stuff, they're not exactly nonprofits, but they're limited by the government as to what they can charge. For the cosmetic stuff, it's a little bit different. But for how much the hospitals cost, how much the procedures cost, basically the government says this is how much it costs, this is how much you'll do it for, and as a patient, I'm paying 30% of that. It's pretty inexpensive. It's not inexpensive enough to consider it for medical tourism. Thailand, I hear, is very good for that. It's very inexpensive and very high quality there. And Japan is a little different. I mean, some of this stuff is not very comfortable. I'm not comfortable with how they're doing things, but for the most part, it's a very good healthcare system. And the nice thing is you don't worry about it. You just go and get the thing and even get whatever it is that you need done. And even then, you don't have to worry too much about the cost. You can get separate insurance for if you're going to stay in the hospital, so that that insurance will pay for your room and for extra food or for different food or whatever. But the basics are all covered. I'm not sure about things that are chronic, as far as like insulin and stuff like that for diabetes. I maybe you can put that in the information down below if you are familiar with that in Japan. But the medicines here are, in my opinion, not really strong enough for particularly the painkillers. And Japan doesn't use a lot of pre-pill formed medications. So I've seen, particularly for colds and influenza and stuff like that you go to the pharmacy and you get bags of powder. And so that's, I'm sweating, it's hot, it's summer in Kansai. Is unpleasant. And so it's a little different from what you'd consider back in the States, which can be trying. Generally, the healthcare system is good, but it's not perfect. There are definitely some things that I'd like to see changed, but it is a really good, basic, solid healthcare system. And if something comes up, I don't have to worry about it. I know I'm going to be able to get whatever it is that I need from the system. So yeah, so I'll talk more about this perhaps later on. If you have specific questions, go ahead and ask in the comments below. And yeah, so the long and short of it is I pay about 10 to 12% of my monthly income. And then when I go to the doctor, I pay about 30%, and it covers contacts, it covers dental work, basic dental work. If you have a tooth replaced, if you get the higher quality, more pretty versions, then they're not going to cover as much, or maybe sometimes not at all. And you have to pay for everything out of pocket. But even then, it's still fairly reasonable. Things like LASIK are not covered at all because it's a choice. It's technically cosmetic. So, although I wish it wasn't. Okay, you all have a great summer. I gotta go find an air-conditioned room because this is just too hot. I'll talk to you soon. Bye.